Also overnight, long lines at State Farm Stadium as hundreds of people drive up to get their COVID-19 vaccine. Now, this is not video from last night. This is about 4 a.m. where cars were lined up already. So clearly there is plenty of demand in Arizona for COVID's vaccine. So let's check in with Kylie right now for the latest.
Good morning. By now, many of you probably know that people in state's 1B group are able to get vaccinated here in Maricopa County and in some other counties across the state. We know that there were some difficulties if you live in the valley signing up yesterday. But how did administering the shots go? Joining me now is Heather James. She is the director of nursing over at Dignity Health. She is live at their Chandler site this morning. Good morning, Heather.
Good morning.
So I have to ask you how day one went of this new phase.
It went perfectly here. We were very busy, did about 3,600 vaccinations yesterday, which is what we had aimed for. So our throughput is working and everything that we had in place.
So talk a little bit about the differences between the phase 1A group, the healthcare workers, and then getting these people in phase 1B vaccinated, especially those seniors 75 and older. How has your approach changed?
You know, it's not, you have to change the way the terminology you use. You're not talking to fellow healthcare workers, you're talking to lay people that don't understand some of the terminology we use. We have to slow down a little bit with our older folks and just making sure they really understand the process, and also take the time to listen and listen to what concerns and fears they have and make sure that we address those before we vaccinate them, because that's what's fair.
You had 3,600 people, you say, get the shot yesterday. Any issues with allergies or any side effects after? I know they all have to wait 15 minutes before they can leave.
Right, 15 or 30 minutes. If somebody has a history of an anaphylactic reaction or a drug allergy, whatnot, we have a physician speak with them and see if we need to monitor them longer. So there's some that we do watch for 30 minutes. We've not had any issues here. If anybody does have an issue, it's usually anxiety. We have EMS on site who is able to evaluate them and talk through it with them and do vitals and see if there's a need to transport them for further evaluation.
So lastly, how do you ensure that you don't have any leftover vaccines each day? What do you do to make sure that you have pretty much the exact number that you need?
That's a really good question. So we have a lot of folks that are here that are due for either their first or second dose, and we keep a running list on site of our workers and our volunteers so that at the end of the day we keep a very tight count, and our pharmacist is involved in that. And so the last 10 minutes there's a lot of radio chatter, making sure that we don't overdraw, and then we start just going down our list of folks, and we haven't had to throw any away at this point.
So we know this next week will be busy for you. Do you guys expect to ramp up even more?
We did work with the county because of the lack of availability of appointments. We did some expansion here. I know that we're already very stretched. We did add an extra hour on and then expanded our throughput capability during the day to add. That adds about 600 appointments a day just for our site. And so trying to do our part, I know that we're stretched thin, but there's such a need for this, and the quicker we can get it into arms, the better.
Heather James, we appreciate you joining us this morning again, running the Dignity Health site, Scott, over at the Chandler Gilbert Community College.